So you've been having more and more anxiety symptoms, and you want to have an as-needed medication option available to you for when you're having panicky moments, but you don't want to take anything that's addictive. Well, today, I'm going to fill you in on Hydroxyzine and give you 5 must-know facts about this medication, so stick around. So before we even get into the 5 must-know facts, I need you to know that this medication goes by 2 names, and doctors will use these names interchangeably. So Vistaril is a brand name, and Hydroxyzine is the generic, so don't get confused. Fact number 1 that I want you to know about is what this medication treats. Hydroxyzine has many FDA indications for conditions outside of the field of psychiatry, but we use it most for anxiety and tension. Some providers will also use it off-label for things such as agitation, aggression, or insomnia. Fact number 2 that you need to know about is how this medication works. So hydroxyzine is considered to be an antihistamine, and it works by blocking histamine 1 receptors. It's actually pretty similar to Benadryl, and it typically helps with anxiety and insomnia because of its sedative properties. Fact number 3 to know about is how hydroxyzine is prescribed. Hydroxyzine comes in tablets, capsules, liquids, and injectable formulations. So the dosing is quite variable, and the nice thing about this medication is that there's a wide range of dosing options, so we can really tailor it to the individual. If I'm using this medication in kids or teens, I'll usually start by giving 12.5 to 25 milligrams daily as needed, and then gradually increase the dose from there. In adults, my starting dose is generally 50 milligrams daily as needed. And so this medication can be dosed multiple times per day. And a lot of people ask me, how long does it take for this medication to start working? And many of my patients will tell me that it takes between 15 to 20 minutes, and then the effects will last up to 6 hours. And then the max dose for this medication varies based on the age. So for children under 6 years old, the max is 50 milligrams daily in divided doses. In kids 6 and over, it's 50 to 100 milligrams daily in divided doses. And then in adults, you can dose as high as 50 to 100 milligrams up to 4 times per day. Fact number 4 that I want you to be aware of are the commonly seen side effects. According to the FDA label, the main ones include dry mouth and drowsiness. Another one that I see clinically is constipation, so I'm always encouraging proper hydration and fiber intake. I want you to know though, the label itself states side effects reported with the administration of Vistaril are usually mild and transitory in nature, and this makes this medication one of my favorite as needed options for most people. It's generally very well tolerated, safe, and effective. Something that I want to touch on real quick are the sedative properties. Generally, patients tell me that this medication is not as sedating as Benadryl, meaning that most people don't have a hangover effect the next morning if they take it at bedtime. Or they're still able to function throughout the day if they take it in the morning or afternoon. However, because of these sedative properties and anticholinergic effects, this medication is not my favorite in the elderly because it might cause confusion and it can increase the risk for falls. Now, fact number 5 I want you to know about is how to stop taking this medication. Because hydroxyzine is non-addictive and is generally taken on an as-needed basis, tapering off of it is often not necessary. Most people are able to quit taking it whenever they want. Now, if you're looking to learn more about as-needed medication options for anxiety, click that next video.